Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is the pathway of aqueous humor? Right. Aqueous humor, which is present, actually, it is present in the posterior chamber. So, from the posterior chamber, the aqueous humor goes into the anterior chamber. So, if you see, this is the eye. Okay. Here we have pars plicata, pars plana, and choroid. Similarly, pars plicata, pars plana, and choroid. So these are the ciliary zonules. Here we will have the lens. Okay. So this is the iris. This is the iris. Okay. So this is the posterior segment. This is the anterior segment. This is the posterior chamber. This is the anterior chamber. So the aqueous humor is actually formed. Aqueous humor is actually formed by the pars plicata. So this is pars plicata. It is formed from the pars plicata and then it reaches the posterior chamber. From there it goes into the anterior chamber. And here we have trabecular meshwork is present. So it goes to the trabecular meshwork. And in the trabecular meshwork, it contains uveal, corneoscleral, juxtacanalicular meshwork will be there. So it passes through them and it goes to the canal called as Sclem's canal. Okay, so from the Sclem's canal, it goes into the collecting chambers and from there it goes into the episcleral veins. So this is how the aqueous humor drains into the episcleral veins. So this type of outflow is called as conventional outflow, which is seen in 90%. But in some 10% of the patients, there is uveoscleral outflow. In uveoscleral outflow, this aqueous humor through the ciliary body, this is the ciliary body, it goes into the suprachoroidal space and from there it goes into the venous circulation of ciliary body, choroid and sclera, which is called as uveoscleral outflow, seen in 10% of patients. So this is the drainage of aqueous humor.
thank you and thank you for watching.